All right, hello. Thank you, Sue. I can see that you're pulling up an informational email right now from your pharmacy board that we're talking about. I'm just giving our listeners a sense of what's going on right now. You're live today with Ian Pedersen, medical hemp researcher, founder and CEO of Source CBD, and we're also live with Sue Horton, the amazing Sue Horton from Central Iowa Compounding. I've been working with Sue for some years now, and she is an amazing colleague that's really just been, I want to say, at the forefront of her group in bringing the awareness of CBD. And I'm really thankful for Sue in inviting me out to speak to the International Academy of Compounding Pharmacists a few years ago to have one of our first medically accredited lectures to talk about CBD. And yeah, it's just been really great working with her and working with the tons of different pharmacies and compounding pharmacies specifically that she works with. Very open-minded group, obviously wanting to use natural supports and remedies, and doing whatever they can to, I guess, push the envelope on health and wellness with their own supports and treatments. So very thankful to have her on today. She's just actually digging up a little email that was coming from the pharmacy board. We were talking about some of the regulations as pharmacy boards across the United States are now starting to accept CBD as a beneficial support and treatment. And again, thanks to people like Sue and Dr. Jennifer Birch and Angie Spovedov, we've had some really great people that are actually fighting for natural compounders and keeping the ability for us to heal ourselves and to heal others and give these natural beneficial supports in a traditionally educated and formulated way. So again, thank you everybody for joining us. And we've got Sue. Sue, how are you doing today?
I'm doing great. Thanks for having me. I can tell you I've been a pharmacist 30 some years, and I've been being involved in compounding pharmacy. It tends to be more towards the natural type of healing of your body. And I seriously cannot think of one thing in my entire pharmacy on a prescription or over the counter that has more applications and is safer than hemp-derived CBD. So when I first started learning about it, and this is probably maybe 8 years ago, I was pretty skeptical. I didn't know the difference between hemp-derived CBD and marijuana-derived combination CBD with THC, and learned from a fellow pharmacist and just started experimenting first on myself and with family members, and was so amazed, not realizing I just had the tip of the iceberg, I guess I could say. And now it's my to-go-to for almost anything, you know, whether people come to me for anxiety or sleep or pain or, you know, GI issues or just about anything you can think of. CBD has an application process for that. So thanks to people like you helping me learn more about it, it's been really fascinating. And you can probably explain better than I can about the endocannabinoid system and how that works. You know, what I tell people is think of your body like you have a nervous system and a GI system and a cardiovascular system. You also have an endocannabinoid system, and that system is actually kind of the master of every other system. And so if you put the CBD in your body, what will happen is crazy things happen, because like somebody comes to me for pain and then all of a sudden they go, wow, my mood's better and I'm sleeping really good. Could it be the CBD, you know? And I kind of learned by default like that, but you know, maybe, I don't know if you could describe that endocannabinoid master system better than I could.
Yes, of course. No, and it's amazing to see the effects that you're getting, you know, as a pharmacy compounder on the ground floor where the rubber meets the road, working with people, you know, to see these benefits. And obviously working in 30 years in compounding, you know, as pharmacy compounding, to see the kind of how this in your toolkit can really fit for so many different issues and supports in these ailments. And I'm really, again, thankful at how open-minded that you and your group have been over the last few years in adopting these and bringing them to the forefront. Because again, I think that there's just a certain level of importance of educated people like yourself that are really adopting these protocols. Now, talking about the endocannabinoid system, you're exactly right. As a similar system to, let's say, the central nervous or cardiovascular system or IBD or internal bowel system, we have so many different functioning systems in our body, but what we've really learned is that they all seem to be controlled or regulated by, we like to say, by the endocannabinoid system, which has really been identified as the governor of the central nervous system. And I think it's interesting that research came to us, as I had spoke to you before, in the 1940s, understanding and being able to at least identify the endocannabinoid system as a system that sends and relays messages based on the actual EC levels and the endocannabinoid system levels that we have in our bodies. So moving forward, is we see that endocannabinoid system really as the governor. If we look at the endocannabinoid system as let's say a system of towers, we can picture them like cell phone towers in our body, of which send and receive signals from our cardiovascular system, from our brain, from our neurological pathways. And what we're seeing is that by simply supplying our endocannabinoid system with these beneficial cannabinoids, we're seeing, as you're saying, crazy and amazing things happening with these, with issues relating from pain, from neuropathy, neurological, IBD, IBS, which is nerve issues, in the IG tract. So with that being said, it has been amazing to see really, and to see not just on an anecdotal level, but on a real rubber meets the road level where you're at, where these patients are seeing such benefits. And again, you may be treating somebody for pain, but then they're sleeping better, or they're having less anxiety. And I think what we're seeing is the endocannabinoid system really relates to so many different things. And it's really three kind of important functions that it supports. One, I think, would be cell health, cell communication, and cell proliferation. And that's what I'm seeing, like, out of all of the things that it does, where we have that healthy cell communication, whether that's in neurological or for pain, where we're having an overage of pain synapses that are being sent from an area of trauma, for instance, where there's been an injury, where those cannabinoids feeding the endocannabinoid system then support the central nervous system by really calming a lot of those pain signals and actually relieving. So when we talk about neuropathy and nerve pain, for instance, which is huge in IBD, IBS, you're giving typically the patient, in some cases, a steroid or an opiate. An opiate maybe to calm suppression, and a steroid to maybe boost the system's communication. But what I'm seeing in some cases, and not you necessarily, but in typical medicine, is they're just trying to block the pain receptors. And we've even seen that with things like gabapentin and other drugs, where they're really trying to block the pain receptors and signals. Well, that's what we're really talking about with endocannabinoid system, is those signals and cell communication. So if we can look at the cell communication in that way, and how we can support the cell communication to relieve and alleviate some of the overage of those synapses, whether that's a neurological disorder from, like seizures, et cetera, or an overage of synapses of neuropathic pain signals. Because what we're really talking about is communication, right? When we talk about cells, and so that's what I've identified in the last, 6 years, really, is that it's really coming down to the healthy cell communication that really supports the cell health and the cell proliferation. And, and whether you're taking a CBD for neurological disorder that's going to support that cell communication, like, a child that has, seizures and multiple, Dravet syndrome, et cetera, or having multiple seizures, it's going to calm those signals. Well, it's going to do the same thing that we've seen in our research with those pain signals, with neuropathy. So we'll have somebody that has IBD or IBS, and they'll take CBD, and it will completely calm and alleviate those signals that are being sent from those nerves. But what we really believe is the cells that are not only being supported by the endocannabinoid system and the cannabinoids, but they're having a healthy cell communication, which really takes it a step further. Instead of just controlling the pain or speaking to that symptom, because we're really looking at the symptoms at that point, right? To actually speak to the root cause and the support, which is the cells are angry. The cells aren't communicating correctly. The cells have then become inflamed. And at that point, the cells are having trouble proliferating. The cells are having trouble growing, living. And so you're in a point where you've fallen completely out of homeostasis. And to be able to support, in this case, for instance, to be able to support the endocannabinoid system with these cannabinoids, it puts your body in a place to where it starts to alleviate some of this overage of neuropathy, pain signals. And so that's like just in that one case to mention, talk about IBD or IBS, how it completely can alleviate those conditions and Crohn's and really support people's diets and ability to function just with supporting the endocannabinoid system. So I think that's one example how the endocannabinoid system and supplying it with cannabinoids supports, again, cell health, cell communication, and ultimately cell proliferation. Because if we're all made of cells, we would like those to proliferate, meaning grow and live in a positive way. So awesome. That's where we're at. So if you could tell me maybe just about a case or two, or somebody that has come in that you've really been able to impact.
There's so many.
Sure.
One of the first experiences I had was a good friend of mine's brother came in, and he had to give a talk in front of all like 200 type of higher ups at Wells Fargo Bank, and he was bouncing off the walls. He was literally could not stand still. This was when I still had the CBD at the pharmacy at the time. I'm like, open your mouth, put some drops under his tongue, literally open the bottle. I said, sit down, take a couple deep breaths. Literally within 5 minutes, he was really, really calm. He's like, whoa. And I said, so take this bottle with you. About 15 minutes before you're going to talk, do a little more. I was just flying by the seat of my pants. And then like right before you talk, do a little more. And he did, and he called me at home that night, and he said, holy cow. He said, my brain was clicking. I could think clearly. I was on top of my game. I was not nervous. I just gave the talk of my life, and he was just like, there's no way I could have done that without the CBD. So that was pretty eye-opening.
Wow.
And so with that, then I started recommending it for people with anxiety. And I found really with anxiety, really, really low doses seems to help, like 3 to 5 milligrams, no matter what the height, weight, size of the person. And in general, I think I've learned through you and through others, the big thing is dosing, and how do you dose people, and how do you know how to dose? And so a general rule that I've followed, and it's not always 100%, but most of the time it's a good starting point, is if I take their weight, so say it's a 150-pound person, and I divide it by 10, so I get 15. So that's 15 milligrams that I say, let's try that in a day. So it might be 5 milligrams 3 times a day, or 7.5 twice a day. I found for most chronic things, 3 times a day seems to work better than twice a day, but sometimes people just can't fit it in their schedule. And then I have them do that for anywhere from 3 to 7 days, depending on what they're treating, and then make a judgment call and say, okay, are you 100% better? Are you 75%? Are you 50%? And then slowly, drop by drop, that's the beauty of having CBD in a drop form. I literally sometimes have people take a teaspoon and drop, 10 drops on there. They can eyeball it, but sometimes people want to be real exact and say, if you're using 10 drops 3 times a day, let's maybe try 11 or 12 and give it a couple days and see. And then once they find their, what I call is a sweet spot, where they've achieved whatever, symptom has balanced or gotten better, then I hold them there for between 30 and 60 days. And then I say, let's try to lower it a little bit, because sometimes it seems like the longer they're on it, the less you need for the same desired effect. So that's kind of how I start dosing people. And I've just found, like with anxiety and panic and stuff, really low doses seems to work. Pain is the harder issue, because I think everybody's, how they rate pain, how they respond to pain, is so different. So for example, I've had a 200-pound guy that had 2 bad knees that had to be replaced. And he was getting relief at 10 milligrams twice a day. So 20 milligrams a day. I had about the same time, I had a gal who was barely 100 pounds, a little tiny thing with a torn rotator cuff. And we dosed her up to almost 100 milligrams a day. And then she finally got relief. So, you know, that's the one thing about it. And I guess it's kind of the fun of working with people. You just don't know where somebody's sweet spot's going to be, you know.
Right.
And I don't know if you see that to be true, but, you know, and being consistent with doses, because sometimes I'll tell people do it morning, mid-afternoon, and evening. Like if you're up, you know, 16 hours of the day, divide it into, you know, 3 increments and try to keep on top of it. And then also doing the topical along with the drops for pain, I feel like gets people more on top of it instead of just trying one or the other. It seems like the combination of the topical plus the drops really helps people to get on top of the pain.
Right.
So that's one example. Another example I like to give is my dad. He's 91 years old. He's a type 2 diabetic. He's very thin, but he's on insulin. He's had high blood pressure. My mom passed many years ago, so he has he lives by himself, so he gets kind of anxious and, you know, stuff. But he, once he could get over the point that I was not giving him marijuana and I was giving him hemp-derived CBD, he started taking it. And mainly we started with, because believe it or not, at 91, he still likes to go to the Y 5 days a week and work out. He likes to do weights and things like that. And then he noticed as he's taking it, well, you know, he'd figure out if he took a little before he went to the Y, he'd maybe get a little bit more out of his workout. And then if he was sore when he came home, he'd take some more and put some topical on, because he has a little bit of diabetic neuropathy going on, and that's better. His blood sugar is way more stable, and I think he's using less insulin now that he's on the CBD. He used to be on 2 high blood pressure pills. He's now on 1 because his blood pressure has gone down. And he really doesn't feel anxious, you know, and it's helped with the anxiety, the sleep, it's helped with his exercising, pain, blood sugar. So for him, it's been a win-win because he's had multiple reasons, and he just keeps saying, say, you know, this is something else I noticed. Could this be due to the CBD? You know, and I think he's a pretty good judge because he's lived so long, you know, so that's been really fun. So probably the oldest one at the Y, and he tells all the younger guys all about the CBD and that they should be taking it and stuff. So,
That's awesome, Sue.
so that's been kind of fun.
Oh.
So yeah.
No, that's amazing. So
Yeah.
one of the stories you're telling me, for instance, you know, we're talking about the dosing. First of all, I have to say your protocol is obviously like perfect, right on, you know, seeing that. And obviously from the data that you're seeing, it sounds like you're really hitting those sweet spots, you know, starting out, you know, with the anxiety, as you talked about, you know, at those lower doses, as in some cases, because as we really need to understand that CBD is a stimulant, is classified as a stimulant, even though it works in some cases to calm as a depressant would, it really is a stimulant. So we want to be careful that it can actually, in some cases, exacerbate cerebral activity as it is opening up the endocannabinoid system and synapses. So I think that lower dosing is always great, although there's no toxicity and there's really no issues we can encounter. We just don't want to contribute to the anxiety. So I'm seeing that right there at that, just a few drops and then working our way up, you know, that 0.1, or as you would say, divide by 10, you know, 0.1 to 0.2 milligrams per pound is just a perfect, that is, you know, at that 15 milligrams per pound, that is, or per total pound body weight, that is perfect. And, you know, as far as the pain too, like you talk about with your father, seeing those types of turnarounds where, you know, as a, you know, a person's aging, they're very physical and they want to stay, you know, stay active. CBD for recovery, and he's using it, pre-workouts, and I'm sure he's seen so many benefits from it, obviously, as a turnaround, but pre and post workout, that is huge because, as we know, for inflammation and for recovery right now, CBD is being used by 80%, a huge, I don't want to speculate on the numbers, but a huge percentage of professional sports athletes, from boxers to MMA fighters to baseball players to basketball players to especially football players, where CTE, chronic traumatic encephalopathy, was really an issue, where they want to really, alleviate some of those traumas to the cells in the brain. So yeah, it sounds like everything you're doing, as well as, having the opportunity to have that titration, to where you can really, have a milliliter, a graduated dropper, and you can do your calculation for your body weight. We actually have a dosing calculator on our website for people. If they have any questions, if you just go in, you can type in your body weight, or your pet's body weight in this case, because we also, work with pets and equines. And that'll just give people an easy translation, on that for a dosing calculator. And you can find that at sourcecbd.com, very simple, or sourcecbdhemp.com. But everything you've been doing is so right on the money, it sounds like, Sue. And that really, I think, from the results you're seeing, and from the, hundreds of stories by now that you've seen impacting people, over the last few years, since 2017, 2006, I think 2017, when we first met, or was it 2018? Oh, 60, you're right. No, you're right. Oh my God, it was that long ago. Has it been that long? Wow. Yeah. So, to see what you've been doing and to hear, these results are just, they really let us know that we're moving in the right direction, even though I feel like we're still at the infancy of understanding.
How I met you, and I don't know if you remember this, but I got referred to you by another colleague in the field because I was trying to help somebody with their 14-year-old son who had seizures. And, they were like, well, try calling Ian because he knows a lot about seizures. And this little boy, 14 years old, went to the pediatrician, and they were like, well, we're going to catch you up on all your shots. And seriously, they gave this child, I think it was 7 shots in one day.
Gosh.
And within, 24 to 48 hours, he started having seizures from nowhere, like grand mal seizures. And long story short, I don't know, 30 some trips by ambulance to the hospital, and being on 4 or 5 different medications. He couldn't go into high school because of the seizures. He would, when he had a seizure, he would urinate on himself. It was just a sad thing. And then the medicine they were giving him was making him so, he describes it himself as feeling stupid. That it just slowed his brain down. He was a sharp, smart kid. He just couldn't even function. So the mother was at her wit's end and had heard about CBD. So that's when I contacted you, and we started dosing him. And really, truthfully, I can honestly say within the first dose, his life improved dramatically. And then he became seizure free. And then until the doctors up at Mayo Clinic started messing around with his medication. And then one of them said, you don't need to be on that CBD. That's not doing you any good. It's probably causing problems. And they got afraid, so they went off the CBD, and then he went down a really bad path, and then they've gone back on the CBD. And it's one of these things where doctors just don't know enough about it to help with seizures, but his life changed dramatically. And then, medical people get involved, and sometimes they don't know enough about it, which is why we need to educate people, because it's kind of scary. But wow. So I know with seizures, it's been awesome. And I've helped several pets, because I see, as a compounding pharmacist, we do a lot of phenobarbital and things like that for dogs, potassium bromide.
Sure.
And I'll always ask the owner, well, how are your pets' seizures? Are they totally controlled? And Most oftentimes they're not. I would say a high 75 or 80% of the time, the dog still has issues. So I'm like, aha, I have something you could add to your regimen. And I've had several customers that what we do is I try to be respectful of the veterinarian or the doctor and say, let's just overlap this and see what happens. Just keep your medicine the same. And then once they say, okay, well, you know, they used to have one seizure a week and now it's been 6 weeks and no seizures, you know, well, when you go to the vet next time, let's tell the vet what you're doing and see if maybe we can lower some of your other medications. And veterinarians are coming around to it in Iowa. I mean, I think they really want to do it, but again, in Iowa, we've had the stigma that it's illegal. You know, but they'll tell patients, go talk to Sue over there on the side and she'll help you. But so that's been kind of cool. And, you know, maybe you could share your story because I see you started a foundation
Yes.
for the little girl that you first, that's how you got into CBD, correct?
Yes. Yeah, that was our inspiration. You know, that was kind of occidental for us. I want to say accidental, it was more occidental.
Right.
You know, and working in medical cannabis for so many years and, you know, understanding the benefits that we were seeing early, you know, on more of an anecdotal level to dispensaries, appetite stimulate, end of life care with people with cancer, you know, the RSO treatments. There was a lot of things that were really, you know, pain control, pain relief, and obviously some of the research that we've been hearing, it really, it really let us know that there could be some other ways we could help. And so, yeah, and meeting that little girl, through just an interesting story in itself, it gave us the opportunity to really, and again, I want to thank her mother for being so open-minded, her mother Brianna for being so open-minded, you know, which she actually had to ask, you know, I think, you know, not knowing the legalities and not understanding and being something so new and being a woman of faith, for instance, you know, being a devout Christian, she really had to ask herself some hard questions about perceptually what, you know, quote unquote, the devil's plant, you know, and, you know, things that she had been raised, you know, against. And so in asking those questions, you know, she came to us and we were able to, you know, after it took us about 3 months really initially of working with her to find what would really work for her. And that was, you know, that was, I think, just one of the most interesting parts of the journey. But once we found something that really worked for her, we knew we had something special. And based on so many different other children, we felt like we had to share that. And so we've been moving forward and we have fortunately been able to work with quite a few children and adults with seizures, neurological disorders, you know, children and adults, specifically children with autism, you know, and with that being said, you know, this foundation, it's taken us some years to really have the opportunity to put it in the right context and really, you know, have the opportunity, I think, give it what it needs. And so we're thankful we've launched the Kirsten May Moore Foundation, which is in honor of baby Kirsten, you know, and if you're curious, anybody online watching can look up the Miracle of Baby Kirsten. She's on Facebook listed as the Miracle of Baby Kirsten, is one of the only children that have survived with anencephaly, as the life expectancy is very, very short for children with anencephaly, as that means that essentially she was born without a skull cap in part of her brain. Which they had to graft a skull cap, and it's just, you know, for the inability for any hospitals to care for a child and ongoing, and to be able to do this, it was an amazing procedure. So yeah, so that was the inspiration, and we're just really thankful to have the opportunity to use this, you know, to take this foundation and use it as a vehicle to help other children, you know, because we've been working with so many other children. You know, this last year we've actually donated over $130,000 worth of CBD to children and adults that have been in need. And so we've really been working with quite a few children, but I think this is an opportunity for us to expand that. So we're really, really excited about that. And, you know, telling me that story and hearing that story about that 14-year-old boy, it really touches my heart. It in so many ways. I mean, I have to first say that it saddens me that he wasn't able to continue with the regimen, and, you know, now they're back on it, and, you know, and you know, the inability for care providers to maybe really isolate and understand the benefits. And I get that. I really want to say right now to any physicians that are listening, you know, and professionals, we really do understand that respectfully, it's just not in your toolkit. And that's what we want to see for physicians and health professionals, is really to see it become something that is part of your toolkit, that you can use, that you understand, that you're taught about, that is, you know, you're educated on. And that's something that, you know, I think people like yourself and you know, Dr. Jennifer Birch and all the other professionals we work with, Dr. Jessica Heyman, have really helped us to bring this into a credible realm. And I think that was my mission, you know, when we first met you're right, back 2016, 17 was to bring this to that credibility, start working on dosing protocols, of which were nil at the time. There wasn't a single dosing protocol, as we're talking about, the 0.1 milligrams or taking it to a 10. So I'm really thankful for that experience. I think what we're seeing right now is a huge opportunity to move into an alternative, as you're talking about, an alternative to opioids or an alternative to steroids. I mean, I think as a health professional, we can see that typically it's one or the other that is used in medicine. Is you're either assigned typically a steroid, some sort of a form of steroid, or some sort of a form of an opiate, of which are typically all synthesized, synthetically derived. And so with plant biology and the true plant pharmacology, because I think that that's where a lot of our information comes from, is from plant science. I think we're really finding an opportunity to really have an alternative to some of these opioids and steroids. Like, for instance, we were talking about IBD and IBS. There's a new study out right now that has just come out by Professor Raphael Mechoulam, he's basically the godfather of cannabis. He's been working to isolate the first cannabinoids since the 1970s. He's an Israeli doctor who is just an amazing doctor that's been out there basically working on the ground floor for the last 40 years in its infancy to promote the understanding of the endocannabinoid system and cannabinoids, and isolating the cannabinoids so that we can test for them. And so interestingly enough, we've come across a new, essentially it's a cannabidiolic acid. And so to kind of take a step back here as we talk about some of these new phyto-rich nutrients that are in the plant. When we look at this plant, we don't really, I think it's, to talk about just CBD or, THC, for instance, is what was talked about in the past. To talk about just CBD or CBN, cannabidiol, or CBG, cannabigerol, or cannabichromine, CBC, some of these new cannabinoids that have been isolated that we're using in our CBD, that, in our CBD products, cannabinoid-based products that give those overall plant compounds, full symbiotic parts of the plant. We're finding that and as I've said before, I think at my talk many years ago, I was talking about how we're still just understanding these cannabinoids and these plant compositions and isolating them. So we've come across a new compound that's been isolated, and it's called EPM301. And what it is a cannabidiolic acid methyl ester. And so it's EPM301 is what it's been basically titled as. And that compound today, we're hoping to understand a little bit more of it. But what it's really telling me in my research and speaking before is that we just don't know enough about this plant. We know it's helping us in so many ways, but identifying these specific compounds that are doing these specific activities, supporting the pain relief or supporting the neurological activity or supporting glaucoma or whatever ailment that we've been, the many researchers have been working with CBD over for many years. But, in the case of, for instance, if we were talking about IBD and IBS just earlier, to bring that back up, we're finding out that this particular compound is one of the key compounds in the plant that is actually working to suppress that activity of pain, and it's also suppressing nausea as well. So it's interesting to see that, not just like the cannabinoids and, for instance, not just the terpenes, and we talk about all the plant composition, but finding out some of these new acids. And I think that's going to be the next real interesting research platform, is to really delve deeper into not just, yes, it's working, and this is, that this specific hemp-derived CBD is working for somebody, but why and what different plant compounds. Now, I don't want to take it so far that we start isolating them, because again, I think there's a level of ignorance there when we talk about isolated cannabis compounds, because we're really missing out on the wisdom of the plant. I mean, I'm just going to say that there is a level of evolutionary wisdom that I can say is happening in the plant, as it exhibits, for instance, properties that maybe 30 to 50 to 100 different plants exhibit singularly. It has all of those different compounds in it, which is really interesting. And so to see that it as a health and wellness, if you're looking to take an essential oil, you're getting one benefit, you're getting one terpene maybe, but to take in full spectrum cannabis oil and a hemp-derived cannabis oil, you're really getting all of those different compounds and terpenes that are exhibited across nature. And so if it's like going out and getting all of these things in nature and bringing them into your body. And I think from an evolutionary standpoint, there's something really intuitive about the plant. So with that IBS, as opposed to taking something like a prednisone as a steroid that is typically promoted for IBS and IBD, just being able to support that with hemp-derived CBD to alleviate the pain, the nerve inflammation, and the nausea, and a lot of those things that you're getting from those issues. So just really interesting to see how this, how we can find a new way in unfolding with this new research and seeing how it's going to really unfold. So really excited about that.
Well, I think one of the things that I keep hearing on my radar is CBD A.
Yes, active CBD. Yep.
So, and how that helps maybe more in GI issues, irritable bowel, Crohn's disease, diverticulitis, things like that, ulcerative colitis. But I think the whole synergy is probably the best thing, but I don't know. Are you hearing that about the CBDA?
Yep. Well, when you talk about CBDA or THCA, what that A stands for is active. And what it means is it's been activated in a certain way. And so you can activate THC or CBD, or you can activate these compounds, basically these cannabis-based compounds. You can activate them through different modus, but typically they're activated through the process called decarboxylation. Decarboxylation is a process. So for instance, if you were to try to take raw THC or ingested the cannabis plant, if it's not been decarboxylated, some of the active cannabinoids can't necessarily they don't have the ability to convert to active into your body. And so as what you're seeing right now with IBS, IBD, Crohn's, those issues is that typically when you take an oil and activate it, decarboxylate it, it then gives the ability for it to then work in calming those areas. So that's, for instance, people would eat like a cannabis brownie back in the day. This would be our anecdotal. They would eat that cannabis brownie, it would automatically alleviate a lot of that inflammation. But we're seeing that that's really where it's coming from, is that different conversion, that in the body, based on the fact that it's been decarboxylated, because you bake the brownie, you put the cannabis in there. Decarboxylation is a process of heating cannabis above about 325 to 350 degrees. And what it does is it activates some of the many different compounds in the plant. And so, having different active compounds, or the way that they're activated in the body, or different levels of those active compounds. Like right now, there was a new issue that was coming up with cannabis, is people were isolating THC as just THCA. Well, delta-9 tetrahydrocannabidiol is legal, not isolated THCA, because of the different compound, not delta-9. There's a delta-8 right now. There's a delta-8 tetrahydrocannabidiol, which is, again, this is outside of our discussion because we're not talking about psychoactive, but to give an understanding, is there's these different differentiations kind of outside the spectrum we're looking at.
Right.
Yeah.
So to kind of speak to that a little is, when you're talking about the whole plant, you want to get the benefits from the whole plant. You really don't want the isolate, which the pharmaceutical that's out there is an isolate, right? Sure. And so you're just not seeing maybe all the benefits, because you're just taking one part of the plant instead of using the whole plant.
Sure. Yeah, right. I think that there's a bit of hubris in man to say, well, this is working. I don't know how the jump was made from THC and then, CBD is working for seizures. Now we need to isolate it, because there's hundreds of other cannabinoids, the acids we're talking about in the plant, the different terpenes, and not just that, but the fats. So when we talk about an isolate, it's really interesting you bring that up. If we're to talk about, for instance, comparing that to isolated vitamin C. So I think you're probably pretty aware, if you're to take a vitamin C capsule, typically you're going to have a small amount of bioavailability, meaning a small amount is going to be actually absorbed into your body through your internal system, organs, etc. But a good portion of that is probably going to be expelled through your lower extremities. You're basically going to pee it out. That's what, there's a very little of it is absorbed. And the reason is, with vitamin C compounds, like isolated vitamin C, is they don't have any fats. They don't have any lipids, and the ability to then bond to your lipids, fats, organs, internal organs, brain, and to be carried through and to actually do things like pass the blood-brain barrier, because they're attached. They bond to these different fats inside your body. And so I think the key to full spectrum up against something like an isolate is that we're understanding that full spectrum is like getting the whole orange. You know, you might have to eat 3 oranges, but you're getting the full beneficial compounds of the plant into your body. Your plant's going to assimilate them, or your body's going to assimilate the plant, but it's also going to bond to your fats because, you know, your internal organs are made up of lipids, so with that being said, that's how we see the process of CBD being carried so much. So like an isolate, in some cases, we've seen it work for vaporizing it, because it instantly vaporizes, immediately saturates the brain and gives an effect. But because it doesn't bond to the brain, it doesn't have fats, it doesn't become bioavailable for 8 hours, it doesn't be transferred through the body, you really don't see the benefits of it. So you may be able to get some benefits, but again, we would always suggest going back to basics as close as we can to nature, right? As a pharmacy compounder, you want to do that, and offer something that has the ability to be uptaken into the body. And I think that's really the key difference between isolates and full spectrum. And again, even if you could isolate a CBD and then bond it to a fat and have it uptaken, you're still missing out on CBN, CBC, CBV, and all the under 150 cannabinoids that I yet have not been able to isolate, because through our research, we're still in the infancy. So, so again, the hubris of man, we don't want to jump forward and try to just say, well, CBD is working, let's isolate it, let's market it. I think we're falling more into marketability. It can be isolated, it can be put into water, it can be put into chocolates, it can be put into gummies. Very easy to work with for a marketability standpoint. And and I think again, we with respect to the pharmaceutical community, we still want to not look past the synergy, as you said.
Right.
I think that's huge.
Well, I did want to say too, you mentioned autistic kids. So I have one mother who, her son was fairly autistic, and he really had a hard time in class paying attention. They were trying to mainstream him, and a lot of days he was very disruptive. He could not go to class. He would never really have eye contact with the mother either. And once she started the CBD, she didn't tell the teachers, and the teachers were calling her going, "Are you doing something different? Because this is like a whole new kid. He doesn't get anxious. He can focus on something for longer periods of time. And he's also giving eye contact," which was amazing. So that's really my main experience with an autistic kid. But I just thought, oh my gosh, every parent of an autistic kid should know about this. Because it's amazing. I just think, just for one kid, just think how that changes their life. So
you're exactly right. Yeah, not just the child's life, but the parent's life. Because, as we've learned with baby Kirsten, and many different children we work with, the parent lives with the same debilitating condition that the child does.
Right.
The parent lives, if not even more, that parent is taking on that, and so the journey I think that a parent has to take with a child that has developmental challenges is, it is the most harrowing journey that any parent would have to take. So with that being said, when you talk about children with autism, and I was speaking about it in my last talk, but I really have to bring this up again. We work with some children with autism, but one child sticks out in particular. His name is Silas, and we started working with Silas when he was about 2 at the time. And Silas could not go out into public. Silas, who had a sibling, would not and never through 2 years of being born, never would communicate or go over to try to communicate with his sibling. Literally would never try to communicate or interact with him. It was very, 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 very seldom, from what the parent had told me. And they would try to take him out to the store, because they're a normal working couple here in town. They try to take him out to the store because they have to. I take all their kids as they're going, and they couldn't keep him in public. He'd lose it. And what we're talking about is the overage of synaptic activity, the billions of synapses that are firing, and is operating at about 7% of brain capacity. You and I, normal humans, genius 8. What's happening with an autistic child, which I believe to reel this back, I actually met the gentleman from Rain Man. I met Kim Peaks when I was in high school, who they made the movie Rain Man about. So I actually have kind of a history in trying to understand autism. And what I saw in meeting him and in meeting many different people that have autism is just the amount of information that they're taking in is so great. And the ability to store information. It's interesting. People actually talk about autistic people as, low functioning or, on the spectrum. Autistic people are some of the most high functioning and intelligent people on this planet. They're using parts of their brain and computing power in their brain that is well above the 6% that we're using as a human, as a normal human. If it, and I've seen that in the ability to calculate numbers, retain information. And so with that being said, and I'll tell you an interesting story about an autistic gentleman, Kim Peeks, who was he was the gentleman they made the movie Rain Man with Tom Cruise and Dustin Hoffman. He was the character Dustin Hoffman played. They brought him to our classroom, and he has the ability to retain so much information that his handler said, okay, student, go ahead and tell me what your address is, where you used to live. He said, just give me one of your addresses. The kid was born in Chicago. He lived in Chicago till he was like 14. So he said his address in Chicago. Kim Peeks went from that address and started listing every street, every intersecting road, every facility. What he had done is he had memorized all the maps of the United States.
Oh.
I'm like literally, he memorized the phone book. He literally the most highly intelligent creature that I have met. But because of he's taking in so much information, it's a challenge for him to disseminate, compartmentalize, or to just do regular activities, right? It's like Einstein. They used to have to stick sticky notes on him, and they put him on the tram in San Francisco, and he would literally go from place to place, and they'd have to tell him to get off. They'd have to put, this is Einstein, stop, like sticky notes on him, because he was so in thought, So again, going back to baby Silas, and, he's taking in so much information that it's just, in children with autism, that's just making them unable to function on a regular level and communicate. So after working with him for literally just a week, the mother who had contacted us when we were in Hawaii, it was so funny. We came back. She's actually was a resident of Hawaii at the time. We happened to be visiting there. Ended up contacting us. And within the first week, the child was in a place where they could take him out to the store. Within 2 weeks, it was Halloween, because this was back in October. I think I was speaking in like September in Hawaii when they contacted us. We started working with him in October. By Halloween, he was able to go out and stay out in, we have a little town here, Old Town Cottonwood. All the kids come, and it's, they go to all the downtown shopping centers, and it's just packed. I mean, it is crazy. He was able to go out and stay with them. He's started communicating with his brother. He is now in preschool. It's completely turned around. Like the quality of life that the parents expected with their child has been just completely exploded. And now they're living with a child that communicating with the sibling, they can take him out. He's having a relatively normal quality of life on a 1,000 milligram a month regimen. So we started him and he was about 25 pounds. And now I think he's probably up to about 30, maybe 35 pounds, something like that. And so, to see that, and then from what you're telling me and to see all the different data, I think that the autism is going to be one of the next and most important things for us to really focus on for neurological disorders. And seeing what we've, when working with the neurological disorders with seizures, it's only relevant that if you have an overage of synaptic activity from seizures that are constantly firing, and those are being calmed by CBD. We have PTSD, which is an overage of synaptic activity, fight or flight, right? Being calmed by CBD. Right. Then why shouldn't autism? It's, shooting from the hip. That's where I was really, feeling that it would have a dent. But to see that is probably one of the most special stories that we've had to share today. And with the Kirsten May Moore Foundation, we can now help other children and continue to get them on these regimens where parents that just can't afford it, because we know CBD in some cases is expensive. It's just a cost, and especially in our society today, with what's happening right now, I know it's a challenge. So yeah, so amazing stories. I'm really happy you're able to share that with me, Sue, because it again gives me, that understanding that this is really happening, and it's not just something that is anecdotal. This is really something that is helping people. So thank you for sharing that.
I had a question for you. Have you worked with anybody with Tourette's syndrome with CBD?
Yes.
Because I do have a mother who has a child on it. It is helping. but now they've added another medication called Haldol.
Mhm.
And the Haldol
Yeah.
is, she feels like the Haldol is interfering with the CBD, or it's just not as effective. Like the Haldol is causing side effects.
Mhm.
So
Sure.
I didn't know if you've had experience with Tourette's, and if so, is it
Yes.
dosing higher, or because I told her to up the dose and see what
Yes.
happened. Yeah.
Yes. So we actually had a case by the name of Trevor Brady. A friend of mine from school contacted me, and her son, just out of the blue, Trevor at about age 9, no, I think he was 8 at the time, just started having full-blown Tourette's. But he wasn't having the verbal Tourette's, whereas you would just be speaking and yelling, random things. He was having uncontrollable movements with his body, and he's in class and
Right.
it's starting to become a distraction. And so finally they got him on a 2-day on, 3-day off schedule where he's going, on and off to school because he's really such a distraction to the classroom, and it's killing his self-esteem and, anxiety. And we ended up, contacting him, got him on 1,000 milligram within the first day. It just immediately calmed his Tourette's to a point where he just, on a 9 out of 10, it was, on a scale of 1 to a 10, he was an 11, and it brought it down to probably a 2. So we started working further to where basically you'd be sitting there with him, and about every minute or two, you would have just a little, very small twitch, compared to, so he's able to get back in school, able to get back in class. He was actually able to get on get his grades up, and then he was able to go in front of the class, which was really huge, and go and speak to the class and tell the class what had been happening to him because he'd been so alienated with the condition. So he's actually able to walk up and speak to the class and tell everybody what had been happening, and that he's on source now. Well, he's on a CBD now, and he's doing better. So with that being said, we have seen some huge impacts. And again, shooting from the hip, because again, I, as not being a physician and just wanting to add a natural beneficial support to somebody's diet that can help them, it was me saying, well, I've seen this happen with other neurological disorders and an overage of synaptic activity, as we're talking about, and how can we calm those synapses, from firing? So yeah, that was a huge case. And I think, as we move forward, any cases that you have, that in the future, especially children, Sue, and I invite anybody that's listening right now, if you have a child out there that has some serious issues, neurological disorders, etc., please feel free to reach out to us, and we'll see if we can get your name and information to the Kirsten May Moore Foundation, and that way we can start making an impact in your child's life, because this is something that is seeing for us is believing, and really seeing these types of stories have been, it's been the most powerful journey. So we're really thankful for it, honestly.
Oh, awesome.
I think just real quick, I think we might have a few questions.
Okay.
I'm going to go ahead and just check. We have a moderator. I just want to go ahead and check. Perfect. All right. I'll go ahead and wait for the host to come back on. Emily, I know she's watching right now. And so, and basically in wrapping up today, Sue, where do you think you see do you think you see a future with CBD in compounding pharmacies, and you see the boards loosening up, and you have hope for us to be able to bring this into the future?
I think it's going to be, I'm hoping it's pretty mainstream here. The hardest part is, like in any industry, there are bad players out there. Yes. And so a lot of the CBD products, because I see this all the time, people will come to me and say, well, I tried that CBD and it didn't work. And I'm like, well, what kind did you try? And, inevitably it's a kind I don't know. And I say, well, I don't know anything about that brand, but I do know something about this brand, and I'm comfortable with it, and I've seen results with it. So I just like to have you try this brand. And that makes a huge difference. And I don't know, maybe you could speak to it more, but I've heard up to possibly 70% of the products out there really aren't above board. They really aren't a therapeutic product. They really aren't what they say they are. And, I've had people, when they were selling it in Iowa, come into my pharmacy, and they go somewhere and spend $250 on all this CBD, and nobody can help them with dosing or this or that, and they didn't get results. And then they come to me and they spend, you know, maybe $50 or $60 and they get results. And you know, so that's the hard thing is it's a challenge for me because I don't want to speak badly about other brands, but you know, I think that's where the FDA is finally going to get involved and give some guidelines. And, you know, you as a producer of it will, you know, could probably speak to that more, but that's my challenge. There's a lot of bad players out there.
Sure. Well, you know, and coming into the industry and really being one of the pioneers to first launch CBD to the national stage and doing our research and education, we found out that first of all, it was lacking there were some polar issues in the industry. One was a lack of education. One was a lack of research, as most people were really just looking for an opportunity, maybe with a product and a company. Because, you know, that's really where we came in first, education and research and study, and then accidentally formed a company out of it, you know. So, you know, looking at the 1 to 3 probably credible players in the industry from 2016, now being saturated by probably 40 to 50,000 different companies, products you can find on the market. If you go on Amazon right now, there's 20,000 different listings. I don't think you'll find 20,000 different shoe listings or 20,000 different alcohol. I just don't know if there's a need for that. But what we've really seen is a race to the bottom in pricing and quality. And so as CBDs become popular and, you know, everybody's talking about it, everybody and their mother has come out there and tried to launch a CBD company. You know, people that have little experience, maybe a former sales rep of a company, decided, oh, I'm going to now make this because I saw a success, or, you know, and so we're finding that just a lot of people aren't necessarily moving into the space for the reasons that we did. And with that, I think you're going to find some questionable practices, because I think intent is probably the hugest driver for anything. And you just have to ask, what's your intent? You know, our intent was in helping a little girl and trying to provide credible research and to really bring this into the forefront and help people like yourself and other professionals understand that we can really make an impact. Others may not have such an intent and maybe more focused on different practices. So with that being said, you know, I think it's important to, you know, to find people, if you've been doing credible research and you have some case studies and you've been out there supporting and working with professionals, my hat's off to you, because I think you're doing the good work in the industry. And anybody that's doing that, you know, I could say is doing the hard work, but there are very few of those players in the industry right now. So the most important thing you can do is, you know, first of all, speak to a professional like Sue, you know, a health professional, to try to get some understanding of it. Look at the test results, make sure you're getting a quality product, make sure you're getting a product that's processed in a way, and then the education, the information on the dosing protocols. Because I think, like you're saying, it could be maybe they're not getting the right information. Maybe they're not getting the right information in dosing in correlation. Maybe they're not getting a good product. But it is important that I think that we really try to, you know, direct people in the best way we can so they can make the best informed decision on finding a good quality, clean and healthy product made with a quality process, and find some information that can really help them when they're entering on that journey with it. You know, I think that's the best thing people can do.
Awesome.
So it looks like we do have just a couple of questions. I see. So how does CBD work for fibromyalgia? Well, Sue, I think you could probably speak to that as a health professional.
Yeah, I've had several patients with fibromyalgia, and you know, fibromyalgia can be a complex issue. You know, what I used to use mainly before CBD was I used a lot of magnesium, both topically and orally. And I found that if I would add CBD to the magnesium, it's kind of a win-win situation, because one of my patients, she wakes up and she never knows what's going to hurt. And it's always, her pain is worse in the morning. So she'll keep the topical nearby. I mean, she keeps the drops next to the bed, and before she gets out of bed, she does the drops, and then she'll use the topical on the area that is hurting her the most that day. And then she can get up and move. She says it takes her about 10 to 15 minutes. She wakes up every day, assesses where the pain is, starts her CBD regimen, and she can get up and go, where before she said sometimes she just maybe never even get out of bed for the day, just depending on how she felt. So, you know, that was probably my most severe case, but I do have luck because I think it helps with the inflammation and, like you say, quiet the synapses and the pain response. But it's definitely worth a try if anybody has fibromyalgia. So
yeah, I think you hit it right on. I think you hit the nail right on the head there. Yeah, definitely. You know, working to just, you know, alleviate some of those synapses that are coming from that localized area, and then being able to actually put the CBD topically on the localized area that's had the trauma. You know, or the, you know, the overall fibromyalgia as you grow. You know, and then internally, you know, being able to take that, something that's going to really bond to your cells in your body and give the ability to actually find that area, whether, you know, being, you know, hands, fibromyalgia in your hands, knees, joints, whatever joint issue, in whatever whatever area, you know, in the osteo system. So, you know, with that being said, definitely fibromyalgia has been huge. It really, we found it takes a little bit of time, kind of build up in your system sometimes. Maybe it might be a week to a 2-week turnaround. The topical seems to affect very quickly, but that, you know, real week, 2 week, and sometimes a 30-day turnaround for people that have some real serious nerve ailments, fibromyalgia, osteo issues, arthritis. That's what we really see, about a 30-day turnaround. Once you find, again, like Sue was saying, that real sweet spot, you know, you start out your body weight, you find the dosing protocol that works for you. You know, at that point, 1 to 0.2 milligrams per pound. You measure it on the dropper because, you know, as all the products are listed milligrams per milliliter, that'll give you a sense of where the dosing can be. And yeah, I think it's done amazing things for fibromyalgia. So let's see here. So we have another question from Mark Krisiak. Hey, Mark, how are you doing? Thank you so much for joining us. So it says, as a retailer of your products, as you are, is there a hotline per se if one of our customers has an issue that is beyond our CBD knowledge, something we would like confirmation? Now, I'm not exactly sure if I'm understanding your question, Mark. I'm thinking maybe you're asking, is there maybe a line that you shouldn't cross in maybe recommendations or making medical assessments? I mean, I think, you know, if you're really leaning towards that, if that's your question, I think the most important thing we can say is, you know, we're not selling a drug. We're not promoting a drug. You know, we're promoting a natural beneficial support that is, you know, herbally derived. And with that being said, I think understanding that we're trying to support the immune system and the endocannabinoid system with something just as beneficial that you could be getting, like any vitamin or mineral support that you're missing in your diet. So I think it's important to try to assess a person's issue, but to really say and identify and say, hey, you know, try to speak with a physician or your health professional, your doctor, and try to get a sense of how you can implement this into your current regimen with what other, maybe if you're taking another drug or if you have other issues. You really want to make sure that you're at least opening up the dialogue, I think, with a health professional. You know, as a person that's a retailer, I think you want to be very careful because, again, as the FDA states that, you know, we're not here to prevent, cure, treat, or mitigate any disease. That's why we'll go to a health professional like Sue, you know, who is a compounding pharmacist, or a doctor or a PhD like Dr. Jennifer Birch, people we work with to really get a better sense of how this can help you from a natural beneficial support level. But that's really, I think, the key to understand is that, you know, I don't think there's really a hotline, but we don't really want to be giving, you know, trying to dive into medical knowledge. We really want to give the opportunity for the person to, you know, get the best information they can and make the best decision they can. Thanks for your question, Mark. We appreciate you out there so much.
And you know, the what's the website? The government's website. Just drew a blank.
FDA.org?
No, for all the medical research studies.
Yep, the National Health, the NHI. You can go to the nationalhealthinstitute.org, I believe. And then have all the PubMed papers.
Yep, yep. Or even PubMed.org.
Yeah,
and,
yep. The National Health.
Type in like CBD and fibromyalgia, and you'll just get unbelievable hits. Or CBD and, you know, seizures, or CBD. And I go on there about every other month, and it just explodes from, you know, every couple months. It just is exploding, all the studies that are coming out. So that's a great place to lead people if they want to get some good studies to actually bring to their physician.
Yes, no, indeed, definitely. And then, yeah, the National Health Institute, that's actually when I brought in my first, when I did my first medically accredited lectures with the IACP and you guys, I was actually, I'd been researching over about 10 years of studies that I had found. So you actually find quite a bit of studies that we'd have no idea that are actually on there on the National Health Institute site. And then of course, some of those PubMed papers, which really, again, lend a huge amount of credibility to a lot of the anecdotal research and research that we've been doing, and really gave me the understanding that I wasn't just, it really gave me the understanding for some of the modus operandi that's already been in place and some of the scientific method that people have been employing with these cannabinoids. And so, yeah, definitely, like Sue says, go to National Health Institute. You can find your own, a wealth of information by just typing in arthritis, fibromyalgia, cancer, seizures, Dravet syndrome, and literally you'll find, by now there's literally 600 papers or more. So,
Oh, yeah.
very important. Very important. So let's see, I see another question here. Are drops more effective for pain than capsules? Essentially, I would say, and I think you probably agree, they're just about the same. If you're to put the drops into a capsule, let's say a natural clear capsule, and to ingest it, it would probably just take a few more minutes for that to for it to burst into your stomach. As far as taking the drops, we in some cases recommend that you can hold it in your mouth, but it's not necessary. It really just needs to be absorbed into your body, so you don't really need to do the whole liposomal thing. So I'm going to say either way, I say that they most likely we're going to work very similarly within just a few minutes of each other. The drops will immediately start to absorb, whereas it's going to take a few minutes for that pill to break down. And of course, if it is full oil, not like an isolated pill of CBD, which again is not going to bond. If it's just a powdered form of CBD, it's not. You're going to have very little benefits most likely from that.
And the other thing I would add to that is that, capsules are a certain milligram, like a 5 milligram, a 10 milligram, or so on. The nice part is about the drops is you can get whatever milligram you want and you can adjust it. In my experience, truly is the longer somebody's on it, the less they need for the same effect a lot of times. So, that helps your pocketbook too. If, say you're taking a 15 milligram capsule and you only really need 10 milligrams,
Sure.
So
Yeah.
not that I'm saying no to any capsule, but I really like the ability to adjust the drops just because maybe I'm a pharmacist by nature.
Yes.
But
Yeah, no, I can see that, Sue. And I think what you're saying is absolutely correct. You give somebody the ability to really customize the dose that they're going to need for themselves. And that's really what it is. I think we are all unique. We're all different. We all have different pain levels. We all have different issues. And just like I think any pain medication that was prescribed by a doctor, they would say, well, here's your body weight range. Here's the acceptable range of what you may or may not need. You may need 1 a day. You may need 2 or 3 based on your pain levels and issues. So
right.
Again, as you're saying, I think that really gives an ability to customize it. So very nice. And I'm seeing just one last question here. Does it help for chronic fatigue? Have you noticed it helping anybody for low energy levels?
A lot of times people that come to me have multiple things going on, and fatigue is always, no matter whether they have pain, whether they have a hormone imbalance, whether they have whatever, it seems like fatigue is just part of our day-to-day life. Yeah. And so I don't know that I've had have anybody say, well, I take it and it gives me an up feeling, but I will say people tend to say, man, I overall feel better. I have a better zest for life. I can cope day to day. I can get more done in a day. I can multitask. I get a lot of those things being told to me. So nobody says, well, it makes me jump out of bed and start exercising when I've never done it before. But I would say it's all about balance.
Yes.
And fatigue is really the toughest thing out there, and it's usually more than one thing going on. It can be low cortisol levels, it can be your hormones are out of balance, it can be low thyroid,
Yeah, diet. Yeah, for
but
sure.
I would say CBD helps all those systems, so indirectly it probably does.
No, that makes sense. Yeah, and I would say for fatigue, as CBD is technically against classified as a stimulant, when you talk about that word balance and homeostasis, it's, we've had people that are incredibly highly cerebral activity, bring them down and calm them, like myself. And people that are having just they don't have that stimulated, they're just tired, having fatigue. It can help to bring them up in balance. But again, as you're talking about, there's probably a few other things that are happening there. They're contributing to that. The diet maybe, or some sort of other levels of the body like cortisol, or maybe there's magnesium, or certain things that you're not getting in your diet. Because again, CBD is great, and cannabis and hemp oil and all the full spectrum benefits. But I think people really need to understand that getting as many beneficial natural plant substances and or good quality processed foods, foods that aren't processed, good quality, foods that are made through good quality processes, organic, whether your meats, etc. Those can really contribute dramatically to those levels. And then if you can start to identify those, if you've tried everything, then of course, you work with CBD, and and then I think that word balance is a huge key, is what you're talking about, for sure, without a doubt.
Right.
Awesome. So, I think we're coming to the end of our talk today, Sue. We've been on for a little over an hour. I think our talk's about an hour. So I want to thank everybody for joining us today, and especially you, Sue. You're such a sweetheart.
Yeah. And if anybody has questions, they can always call my pharmacy. So, and
compounding.
Yep.
Yes, great. And I want to thank everybody for attending today. The talk. We're going to be doing these regularly. We'll be holding a bi-weekly to a monthly talk, and I'm looking forward to speaking with other health professionals like Sue. And Sue, I'm really looking forward to seeing you in person sometime. Let me know next time you're doing a vacation run. I'll come out on you.
Yeah, sounds good. Well, thanks for having me. This has been great. And I learned some more today too, believe it or not. So
yes. Anybody watching, you guys can go to the CBD shop online. And you guys, whoever was watching, is going to get a discount for that, as well as Clark's Market. And I just want to thank you all again for today. Everybody stay healthy, stay positive, be love, all love, one love.
Thank you.
Thanks, Sue. You take care. I'll see you soon, okay?
All right. Bye-bye.
Thank you. Bye, everybody.